Millions of Americans are expected to lose their Medicaid coverage in the coming months. Congress prevented states from shrinking their coverage since the start of the pandemic, but now they're taking a closer look. NBC 15's Cameron Kelly spoke with some experts in our area about how this change could affect residents here.
Maria, lawmakers passed a rule in 2020 that kept people automatically enrolled in the government program, even if they no longer met the requirements for coverage. That protection ends on Friday.
Hairlines, we've done the crown, everything looks really good. Okay.
The continuous Medicaid coverage requirement connected to the COVID-19 public health emergency will expire. Assistant Professor of Population Health Sciences Rebecca Meyerson says
states will have the option, will be required to review the eligibility of people on their Medicaid rolls. And it's predicted that nearly 16 million people will lose their Medicaid coverage.
Experts say it's important to stay up to date on your coverage.
As this unwinding of the continuous coverage provision takes place, about 7 million of those are expected to lose their coverage just for a procedural reason. They were actually still eligible, but maybe didn't submit their renewal forms on time.
Covering Wisconsin's Navigating Program Manager, Adam Van Spinkeren, says a big population of people who lose coverage are minorities.
They're more likely to be disparately affected by any change like this, usually because of simple things like communication barriers, technology barriers.
Ready, 1, 2, 3.
He says people should pay close attention to see if they received official mail from the state. If your current Medicaid coverage has not expired yet, you will still be covered.
What they're going to want to do is find their renewal date, whatever it is, be really close attention to the year, get that renewal date, and then wait. People should absolutely not renew too soon.
As states check eligibility, he says people should look ahead.
If you have an offer of coverage from your employer, when you lose Medicaid, you have 60 days to get onto your employer-sponsored coverage. Normally it's 30 days, but with Medicaid, it's 60.
Both of the experts I spoke with say sometimes people are afraid to ask if they need help. If you or a family member needs step-by-step care, you can call Covering Wisconsin at the number on your screen, 608-261-1455. Live in the studio, Cameron Kelly, NBC 15 News.